Good morning, everyone. I thought I will record you a video discussing orthodontics in general practice. I haven't prepared really much material, so I'm gonna speak out loud what's in my mind about this topic. For credibility, my name is Khaled. I have been a dentist in Australia for nearly 14 years, and I have been a dentist for 20 years. I own and run my own practice, Lakeside Dental Spa in Hervey Bay in Queensland. I have a team of 40 staff members of associates, oral health therapists, front office, and dental assistants. So back to the topic of orthodontics. So let me talk about it from an associate dentist point of view. What advice I would give to an associate dentist? I think, or I believe, learning orthodontics is very important for your practice as an associate dentist. When you take course in orthodontics, especially comprehensive courses, you will see your cases a lot different. Your understanding of occlusion will be a lot better. Your planning, even for simple cosmetic cases, the way you will look at the bite, canine guidance, you look at cross bites, narrow arches, narrow smiles. If you can perform orthodontics for those patients, it will make your restorative work a lot better. All your new patient exams will be very different. You start looking at airway, you start looking at function, you start looking at why patients have narrow arches, why they have crowded teeth, why they have wear, why they are probably grinding secondary to airway obstructions. So if you take a comprehensive course, you will look at those cases differently. Now, another thing as well, children. You will start to do some more interceptive orthodontics early on. You'll start to treat narrow arches again and cross bites. If you treat children, you will win the parents usually, because you will see the child every month or 2 months for probably a year or a year and a half, and there's a high chance you will see the parents with them every month, and you will establish very strong rapport with the parent, and you will build your book up really quick. My advice to you is three things. Number one, don't do orthodontics for the money, because you will lose a lot of money initially learning. You will invest a lot in courses, you will have to travel, you will have to attend a lot of training, and also when you do your first cases, you're going to be very slow. Your cases will take longer time to plan, longer time to discuss with the patient consent and going through all the options, and longer time to finish. The chair time will be quite high initially as well. You're going to be a lot slow in putting brackets on or putting attachments on for Invisalign. So don't do it for the money. Do it for the passion of helping patients and trying to introduce more complex solutions or answer complex problems to your patients. And do it for the sake, if you enjoy the planning part of orthodontics, you will find orthodontics more rewarding. If you don't enjoy the planning that will go through it and seeing that patient for every month for a certain amount of period of time, you will get burned out with orthodontics very quickly. So do it because you enjoy helping people, you have a passion to provide extra services for your patients, but don't do it for the money or you will fail miserably. Second advice, don't start orthodontic cases in a practice that you're not sure you're going to stay around for at least 3 to 5 years. Orthodontic cases take quite a long time to finish. And if you leave a practice with unfinished cases, most of the time you might have to come back every month to finish those cases. And that comes to, on the same level of the advice, make sure the practice owner or any other associates, if it's a large practice, are familiar with your orthodontic system. So if you use like deepen system, make sure there's someone else in the practice who can also provide deepen system brackets. If you do Invisalign, make sure another dentist or the owner is accredited in Invisalign can take over the cases. Simply because if you decide to leave or something happen in emergency, you have to leave the practice, you have to move to another country, you can easily transfer those cases to the practice owner or to the associate. You can discuss finance, make sure this is discussed early in the contract. If you take orthodontic cases, I believe you need to have a special contract for that, highlighting exactly if you have to leave midway treatment, how are you going to manage those cases? Are you going to come back every month to finish them, or are you going to refund certain portion to another associate to take over, or are you going to refer them to a local orthodontist at your own fees to finish those cases? So you need to have clarity with the practice owner how those cases will be transferred over. Thirdly, make sure you invest in a comprehensive course. Be very careful with short courses or courses that will claim that orthodontics is easy, you can learn it over a few weekends and you can start putting brackets, and most cases are easy. No, try to get a comprehensive course. I recommend, of course, that's what I did my training with Derek Mahoney in Sydney. Get a comprehensive course to understand airway, to understand etiology, to understand planning. That will take you have a bit of a clinical and a practical aspect in the course as well. You can go and observe in their clinic, some clinical cases, you can do some hands-on. So in summary, make sure you do it for the passion of giving your patients services that will last them and will help them and last them for lifelong. Don't do it just for the money. Make sure you get adequate training and provide enough time in your book and enough finance to get this training properly. And make sure the practice you're going to do orthodontics, you will be stable for 3 to 5 years at least, or there's a very clear system of handing over those cases if you have to leave or if you get sacked. So I hope this information is helpful, and if you like it, please make sure you like this video and share it and subscribe to the channel to get more information. Thank you very much.